This webinar is brought to you by Heathrow Healthcare, an innovative pharmaceutical company. Heathrow Healthcare's journey began in 1993. We have 30 years of excellence and 36 state-of-art manufacturing facilities. Heathrow Healthcare has 300 plus products in portfolio and presence in 126 plus countries. With 21,000 employees globally, Heathrow Healthcare is the largest closely held pharmaceutical company in India and is amongst the largest manufacturers of ARV, APIs, and FDFs in the world. Heathrow Healthcare is Asia's largest API manufacturing facility at SCZ Complex, Visakhapatnam, Andhra Pradesh. Heathrow Healthcare is 360 degrees solution provider striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Heathrow Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, adalimumab. During COVID-19 pandemic era, Heathrow Healthcare, the pioneers in antivirals, offered Oseltamivir, Favipiravir, and Remdesivir to the patients, because of which in August 2020, Heathrow Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, role of Oseltamivir in flu management. We have got Dr. Kapil Rathi as our moderator. Welcome, Dr. Kapil Rathi. Dr. Kapil Rathi is medical director and consultant physician from December 2006 till date at My Health Clinic. Sir is working in general and critical care medicine for 19 years and is well equipped with all general medicine, chest medicine, and critical care procedures. Sir has been awarded by Governor of Maharashtra for excellence in work during COVID times. And Dr. Rathi has been part of trials for MNC and National Pharma in phase 2 and 3 trials. Sir has been working with various NGOs for health awareness by conducting camps and is fellow of infectious disease by IDSA, member of ERS, ATS, ACP, IDF, ADA, RSSDI, and ICP. Sir has held multiple positions in various bodies. Once again, a warm welcome, Dr. Kapil Rathi, and over to you.
Thank you, Dr. Prashant, and thank you, Hetero, for calling me. And good afternoon to all my colleagues who have logged in for this webinar on empirical use of Oseltamivir. So let's discuss something about flu, which is a very common disease in our part. In fact, it is the disease not only for the monsoon but also for the round the year what we see typically in city like Bombay or in the city which are near to the sea area. That is very important. So we'll just discuss about challenges in monsoon like influenza like illness, H1N1, SARI, and COVID-19. So if you see Indian data right from 2017 till 22, you see the cases have been going up of flu, except in 2021 and 22 because of COVID. There were a lot of COVID patients, therefore flu was not diagnosed that well, but there was a flu. So if you see the cases and the death, they are going up from last almost 15 years or so. Next slide. So if you see the number of the cases right from 2015 till 2019, the cases are going to be going actually exponentially high, 3 times than normal. So that is very important. And so are the death. So agar cases agar zyada rahegi to death zyada hogi. So that is important. What it also tells us that flu is getting more contagious. It is getting more little virulent, and therefore you are getting more cases and more deaths. So that is very important. Next slide. So incidence is going up. So if you see the types of influenza viruses, there are 4 types of influenza virus. They are influenza A, B, C, and D. C and D are of no use because they are most in animals. A and B are of our use because they infect human beings. उसके अंदर में भी अगर आप देखोगे तो इन्फ्लुएंजा ए है जो 80% फ्लू केसेस के लिए कारण होता है और इन्फ्लुएंजा बी है जो लगभग 20% लोगों के लिए होता है. एंड वॉट एवर पैंडेमिक्स और वॉट एवर एपिडेमिक्स हैपन्स अक्रॉस द ग्लोब इन द वर्ल्ड, they happens because of influenza A virus. This happens because influenza A virus has got that tendency of antigenic shift and drift which occurs very periodically in an influenza virus. So that is most important is influenza A virus. Next slide. So how does it transmit? It transmits basically from person to person. It transmits through a respiratory route. It transmitted through the droplet infection, through coughing, sneezing, and anyone who is in the vicinity of 8 to 10 feet of an influenza person can get infected. So that is again very important. So flu is like other simple virus. It goes through a respiratory infection, and a healthy adult can infect a lot of people, which are in the vicinity of that person to get influenza. तो अगर आप देखेंगे एक हेल्दी आदमी को अगर फ्लू होता है, अगर वो उसके पास में अगर वो फ्लू अगले 4-5 दिन तक उसके पास रहता है तो ही कैन इन्फेक्ट मेनी पीपल. And in pediatric population, they can infect up to 7 days also. So flu can infect not only you, but also the people who are in the vicinity just by simple respiratory and droplet infection. Next slide. So if you see a symptomatic differentiation between ILI, H1N1, SARI, and COVID-19, if you see first five symptoms like fever, myalgia, cough, lack of energy, and sore throat, they are common with all these four variety of upper respiratory infection. In fact, all the viral infections. But if you see breathlessness, they are very common with H1N1 and SARI. If you see loss of taste and smell, this was very peculiar with COVID. Diarrhea was very peculiar with COVID, and headache and everything are very common with H1N1. सो ओपीडी बेसिस पे कभी कभार इनिशियल स्टेजेस में डिफरेंशिएशन करना बड़ा मुश्किल हो जाता है बिकॉज ऑफ द कॉमन साइंस एंड सिम्टम विच आर देयर विद ऑल द फोर द इन्फेक्शन विच आर देयर. But as the cases progress, or sometimes as it happens, you can always see that you can differentiate between these three or four, generally by clinical or most of the time by doing a sample or by doing a some kind of a investigation. So that is very important. Next slide. So if you see what are the warning signs of flu sickness, कौन से पेशेंट पे हम ज्यादा ध्यान रखेंगे और कौन से पेशेंट्स को हम एडमिट करेंगे. टिपिकली इन पीडियाट्रिक पॉपुलेशन, if there is lot of tachycardia, tachypnea, bluish discoloration, cyanosis, patient is not able to get up, patient is dehydrated, patient is not crying that well, these are the signs that patient is getting more sicker, and this patient might require admission. So that is very important. And in adult population also, if there is a tachycardia, tachypnea, or there is a suddenly shortness of breath, high grade fever, rash, then these are the patient where we need to admit this patient and observe and treat them very well. So that is an important emergency warning signs. Next slide. So if you see why we want to treat, because there are a lot of complications of flu, which include not only bronchitis, pneumonia, or the ear infection or acute exacerbation of asthma and COPD, but also ARDS and death. In fact, we have seen almost 3 to 4 to 5% of patient of flu can go from typically from H1N1 flu can go to a very severe ARDS, pneumonia, and death. So that's why we need to be very aggressive in treating flu initially. Next slide. So how do we treat influenza? So the most important treatment is symptomatic treatment, जो हम लोग देते हैं ओपीडी के अंदर में, जो नॉर्मली आपके 60 to 70% ऑफ पेशेंट जो आपके ओपीडी में आएंगे उनको ये नॉर्मल ट्रीटमेंट देंगे तो भी ठीक हो जाएंगे, जैसे कि बेड रेस्ट है, इंक्रीज फ्लूइड इनटेक है, कफ सप्रेसेंट्स है, पैरासिटामोल है, एनसेड्स है, या फिर कोई डीकंजेस्टेंट है, ये अगर आप देंगे तो मोस्ट ऑफ अपने पेशेंट ओपीडी में ठीक हो जाते हैं मोस्ट ऑफ टाइम, एंड द रिकवरी डे इज समवेयर बिटवीन 3 to 5 days. But some severe cases, like 15 to 20% of our flu cases in OPD, they might require, admission, or they might require little more monitoring. So that is very important. So very important to understand what are the serious cases and whom you have to treat very fast. But treatment of influenza, other than symptomatic, will require some kind of antiviral drug. Which are they? We'll just see about it. Next slide. So you have to treat with antiviral drug, like two drugs which are available in the market. So हमारा पूरा focus अभी antivirals पे है. एंटीबायोटिक हम सब लोग जानते हैं, लेकिन एंटीवायरल के बारे में हमको बहुत लोगों को शायद पता नहीं है, और बहुत लोगों को पता है लेकिन बहुत लोग यूज नहीं करते हैं. सो एंटीवायरल्स आर देयर इन द मार्केट एंड दे आर वंडरफुल ड्रग टू बी यूज्ड टिपिकली इन अ फ्लू केसेस. So there are two kinds of drug which are available. One is the neuraminidase inhibitor and one is the M2 ion channel blocker called as adamantins. So what does neuraminidase inhibitor do? They block the viral neuraminidase enzyme, which is very critical in releasing the virion from the infected host cell, and this will not only progress the disease, but they will also transmit the disease, and they will have this contagiousness very easily. So if you give something like Oseltamivir, which is a neuraminidase inhibitor, you will not only prevent the disease progression, but also you will decrease the infectivity of the disease. That is very important. So Oseltamivir and Zanamivir are example of neuraminidase inhibitor, and they are active against both influenza A and B, both viruses. वहीं दूसरे और एडमेंटिन्स लाइक M2 ion channel blockers, they generally interfere with hydrogen ion channel, therefore they prevent entry of virus into the host cell. That is their mechanism. But these drugs are only active against influenza A virus, not B virus, and the examples are amantadine and rimantadine. So these are the two antivirals which are available. Obviously oseltamivir is a more specific and more powerful drug. Next slide. So what is oseltamivir? It's a potent and very selective inhibitor of neuraminidase enzyme of influenza virus A and B. It's a prodrug. That means it is not active drug. Once you take this drug through your oral route, then it goes into the liver and get activated, and therefore it goes and act against the influenza A and B virus. And this is effective against all the variety of influenza A virus, like whether it is avian, swine, H1N1, or it is H9N2 or H5N1, it will be active against all the flu virus because it is a neuraminidase inhibitor. Next slide. So if you see this cartoon, you can understand what I'm talking. In the upper half, you can see that there is a typical virus, flu virus, which contains all these spikes, orange colored dumbbell shaped. These are called as neuraminidase, and there are blue colored spike, which are called as hemagglutinin. So there are 18 hemagglutinin and there are 11 neuraminidase, which are there on a particular protein complex of the virus. So if you use neuraminidase inhibitor like oseltamivir, ये जाके क्या करेगा जो ऑरेंज शेपेड जो डंबल शेपेड जो ऑरेंज कलर के जो न्यूरामिनेडेज एंजाइम है उस पे जाके बैठ जाएगा और उसको ब्लॉक कर देगा। आप नीचे के साइड में देख सकते हैं नीचे के कार्टून में। सो व्हाट इट डज, इट विल प्रिवेंट द वायरस replication and therefore it will prevent the progression of disease and it will halt the multiplication of the virus and therefore you will get very fast symptomatic relief. So that is most important. So this is how oseltamivir works. Next slide. So it is first oral neuraminidase inhibitor which was approved in more than 100 countries and it is now available freely across the globe and it is endorsed by so many societies which include FDA, CDC and everything. Next slide. So if you see the doses and recommendations, it is very simple. The dose is very simple to calculate, like 3 milligram per kilogram into 2 divide dose. Example, अगर आप 50 किलो के हैं तो आपको 50 मल्टीप्लाइड बाय 3 करना पड़ेगा जो कि 150 मिलीग्राम होता है। उसको आप दो डिवाइडेड डोज में उसको स्प्लिट करिए, लाइक 75 मिलीग्राम दिन में 2 बार आप देंगे and you will give it after food. So very simple to give. The good part is that oseltamivir is available not only in oral form but also in the syrup form. So you can use in pediatric population. So if your weight is less than 40 kilo, like 30, 20, you can decrease your dose from 150 to 120, 90 or 60 milligram, depending on 3 milligram per kilogram body dose. So that is very important. Next slide. So there are a lot of benefit of using empirical use of oseltamivir, and we have seen over a period of so many years, and we have learned that empirical use of oseltamivir to treat influenza not only decreases lower respiratory infection, but it also decreases hospitalization and antibiotic use. So that is most important. So I think if you use oseltamivir upfrontly, बहुत सारे पेशेंट्स को ऑलमोस्ट 30% ऑफ पेशेंट को यू डोंट रिक्वायर एंटीबायोटिक, almost 60% of patient will not go into lower respiratory infection and almost 60% of patient will not require hospital admission. So I think this is one of the best drug which is available as an anti-flu or an neuraminidase inhibitor which can prevent not only the flu virus progression but also decreases the hospitalization as well as the antibiotic use. So that is very important. Where are the slides? I think Dr. Prashant, are you there? Hello, Miss Payal?
Technical issue, he must have left. I'm calling him and checking with him.
Please, please, please.
Yes, just give me a moment.
Can we continue, Payal?
Sir, doctor ka laptop has just got into some technical issue
No
because of
problem. I'll continue without slide, not a problem. I have
no worries. Yes, yes, then you can, sir, continue without, not a
Okay.
problem.
Yeah, sorry. So very important to understand that if we use oseltamivir upfrontly in flu patients, we have, we get a lot of good result, not only in decreasing antibiotic use, but also decreasing hospitalization. So most important to understand is that if you use drug like oseltamivir, that will not only decreases the influenza infection, but it also decrease the chances of pneumonia, the chances of severity of pneumonia, the chances of probability of pneumonia. So that is very important. तो वी हैव टू यूज ओसेल्टामाविर अपफ्रंट इन द पेशेंट. हम लोग एंटीबायोटिक बहुत यूज करते हैं, हम लोग बिना सोचे समझे भी बहुत बार यूज करते हैं, हम बहुत बार ओवर यूज भी करते हैं, लेकिन हम लोग एंटीवायरल नहीं देते हैं. सो अगेन to make you more realize about antivirals, that we should use antivirals in a patient who are flu patients in your OPD. 70% of our OPD patients are flu patient, which is a common cold patient. जहां पर एंटीबायोटिक की जरूरत आपको शायद 30 या 40% लोगों में पड़ेगी, बाकी लोगों में आपको एंटीवायरल देना जरूरी है. इनफैक्ट ऑल पेशेंट्स में आपको एंटीवायरल देना जरूरी है अगर आपके फ्लू के पेशेंट्स हैं तो. So if you can give antivirals and antibiotic together, it is fine. But just don't write antibiotic if there is a confirmed case, or if you see that there is a, the locality or that person or that people, in that same vicinity are getting flu, you should start antiviral. गिव एज सुन एज पॉसिबल. जिस दिन भी आप पेशेंट को देखते हैं, चाहे वो डे 1 हो, डे 2 हो, पेशेंट का सिम्टम हो या आपका देखने का डे 1 या डे 2 हो, उसी दिन आप शुरू करिए. सबसे ज्यादा बेस्ट रिजल्ट आपको तभी आएगा जब आप ड्रग को जल्दी चालू करेंगे, चाहे तो फर्स्ट डे या सेकंड डे. द बेस्ट रिजल्ट इज फॉर फर्स्ट और सेकंड डे. You can use up to 5th day also, that is not a problem, but you should try to use it in first 2 days of the illness. Give it for 5 days, very simple dosing, 75 milligram BD for adult patient for 5 to 7 days maximum, not more than that. And always see that your patient takes medicine. बहुत बार हम लोग क्या करते हैं, एंटीबायोटिक यूज करते हैं लेकिन एंटीवायरल भूल जाते हैं. और समटाइम्स पेशेंट कम्स अगेन एंड अगेन, पेशेंट का फीवर नहीं जा रहा है, कॉफ नहीं जा रहा है, पेशेंट को उसका टॉक्सिसिटी नहीं जा रहा है. सो मोमेंट टू स्टार्ट एंटीवायरल इन दिस पेशेंट, विद इन 2 days पेशेंट रिस्पॉन्ड वेरी वेल. So better to give it as soon as possible from day 1 only, to use antivirals. So that is the only thing what I'm trying to emphasize. And the dosing is very simple, it is very affordable, it is very accessible, it is it is available across all the market, so you can use it. And it's a strip of 10, you have to just give it twice a day for 5 days. So guys, again, what I'm trying to emphasize is that antivirals are very important. Just to summarize whatever I have discussed with you, that common things are always common. Flu is the commonest OPD patient what we see in our practice. This is the typical season of flu which is going on right now because of the cold and environmental problem. So most important thing is to understand is that we have to use antivirals upfrontly. We cannot afford not to use antivirals. That is very important. It is available. It is just our clinical inertia. हम लोग कभी सोचते नहीं, हम लोगों के पास में कभी कभार वो थॉट प्रोसेस नहीं आता है कि हम एंटीवायरल भी दे सकते हैं. बहुत बार हम एंटीबायोटिक तो दे देते हैं बिना सोचे समझे, लेकिन सोच समझ कर भी हम बहुत बार एंटीवायरल नहीं देते हैं. दैट वी नीड टू अंडरस्टैंड. यू हैव टू ट्रीट इट वेरी फास्ट, यू हैव टू ट्रीट it early. That is very important. And empirical use of oseltamivir. Empirical use means अगर आप ड्रग यूज कर रहे हैं, अगर आपके पास में डायग्नोसिस कंफर्म है तो भी आप यूज कर सकते हैं. लेकिन अगर आपके पास में सस्पिशन है, अगर आपने डायग्नोसिस नहीं भी हुआ आपका, चाहे आपने स्वैब नहीं भेजा हो, चाहे आपने कल्चर नहीं भेजा हो, या आपने बायोफायर नहीं भेजा हो, स्टिल यू कैन यूज oseltamivir as an antiviral. So oseltamivir is one drug which you can use empirically, and it is endorsed by WHO to use it in an empirical way. So again, very important to, again, I'm stating the same point again, that use antivirals. They are there for the market. You have to use very judiciously. You have to use very early in the disease, and you have to just give it for 5 to 7 days. So guys, next time whenever you see the patients in the OPD, जो भी आप पेशेंट देखते हो, कफ कोल्ड के पेशेंट या सिंपल अपर रेस्पिरेटरी इन्फेक्शन के, most of the time they will be viral, and antivirals are the drug of the choice for this kind of patient. I think I'll stop here, and then probably I'll take a couple of questions to answer your queries. Thank you so much.
Yes, sir. Hello, sir. You can hear me, sir?
Yeah, I can hear you.
Yeah, my laptop, sir, kuch crash ho gaya. I'm joined on mobile.
No
Payal, can
problem.
you go to the next slide? Yeah. Sir, coming question. Sir, you think that the incidence of viral infections has increased over past a week or 10 days or over past time?
Infections are going up because of the climatic conditions which have changed in last 2 weeks or 3 weeks. The more the colder, more the chiller, more you get viral. Plus environmental pollutions and constructions and other
Correct.
things which are there in the market. So that is very important. So viral infections are on the rise and probably they will stay for another maybe couple of months here.
Okay. Next question, Payal. So generally, sir, it is very important that the patient is brought to the doctor very fast. But I mean, GPs is the first point of contact for the patients, and rightly so. But generally, how soon the patient comes in your experience to the doctor?
Yeah, so generally patient generally for first 1 or 2 day they will try their home remedies, they will try their OTC product, paracetamol or something, kala वगैरह सब लेंगे, and they generally after 1 or 2 days they come to the general practitioner, mostly 70 to 80%. So generally general practitioner will see this patient mostly on day 2 or day 3 of the illness. That is very important. That's why it becomes very imperative and very a kind of a common sense to use antivirals whenever the general practitioner see this patient on the first day of their OPD, because the patient will generally present them to day 2 or day 3 to their OPD, and that is the time where you have to start. In fact, that is the right time to start antivirals in this patient, because patient might respond in next 3 days. Patient can be much better with antivirals. And generally to consultant they also
Correct.
present on day 3 or day 4, but most of the GP will see the patients primarily, and they generally present on day 2 or day 3 of the illness.
Next. You have said this, adequately that patient should, I mean, the doctor should start oseltamivir empirically. But general message to the audience: should they wait for investigations or generally start? Because GPs may not go for investigations so commonly.
Yeah. And in fact, most of the time you don't require flu investigation. That is very simple. If you
Correct.
do a simple CBC, you see a little bit of, leukopenia. That is again indicator of a viral infection. Unless the patient is so severe or sick enough that you have to send a swab or you have to send a biofire or a respiratory secretion for an kind of a PCR. Otherwise, we don't do. Most of us will 80% will not do any investigation or any very specific investigation for flu virus. It's a more of a clinical diagnosis, more of a local diagnosis. So you have to just treat empirically in this patient. That's why I'm telling you, if you treat empirically, you have to use antiviral also empirically. That is most important. So no
Correct.
need for
Correct.
any hi-fi investigation, just your clinical knowledge, your patient history, and probably the awareness which will clinic the diagnosis.
Right. Next question, Payal. What are the factors apart from early start of treatment? Are there any factors on which the clinical response depends?
Oh yes, clinical response depends on your age, your genes and everything, your comorbidity like diabetic, hypertensive, or patient who's on long term kind of a treatment. That is very important. Plus, it also depend on your environment, your sanitation, your living habits, and probably your immunity. So that is very important. So I think not only the drugs but all the symptomatic medicine should be also there along with the
Yes.
antivirals that will help to bring back that patient normal very fast. So that is very important.
Next slide, please. Generally, for how long? I mean, your slide has shown that, but
Yeah, generally we give this drug for 5 to 7 days maximum, and patient respond. If patient, most of them will respond by day 3, day 4. So if they are going to respond, they are going to respond in first 5 to 7 days. After that, probably
correct.
they don't respond.
Next one. So, I mean, antibiotics are written almost for every indication. What is
Oh
your
yes.
opinion about antibiotics?
Look, the practice is like that only, that you have to write antibiotic. In fact, antibiotic is like a knee-jerk reaction. The moment you see
Yes,
patient
yes,
fever,
yes.
cough, cold, we just write it. But most of the time we are overusing it almost in 40, 30, 40, 50% of cases. We don't require antibiotic, a simple symptomatic medicine and antiviral. So we use antibiotic left, right, and center, but we don't use antiviral in that way probably. And I think it is more rational to use antiviral upfrontly rather than antibiotic. If required,
Correct.
you can use antibiotic, but don't forget about antivirals.
Correct. Our comfort level on antibiotics is very high generally.
Oh yes, that is how we have been trained.
Correct. How is oseltamivir tolerated, sir, in your experience? Any major side effect, any contraindications, precautions?
No, let me be very straight with you. It's a very wonderful drug. The tolerance is absolutely very fine. There is nothing to be worried about any major side effect. There is no drug-to-drug interactions, and patient take it very simple. It's a capsule, simple twice-a-day therapy after food, and hardly any side effect. Maybe sometimes some nausea, vomiting, maybe in some few cases, but most of them will tolerate it very well.
Yeah, you have already answered this. Because for GPs, that how it is tolerated is more important, as important as possibly the efficacy.
Yes, yes. Don't worry about tolerance. They are very well tolerated. If patient can tolerate antibiotic, they can tolerate antiviral. Don't worry.
Well said, sir. Your overall experience, take home message for the audience.
So again, I will repeat myself. Flu is the commonest OPD patients what we see. In fact, all general practitioners with what they see. Flu is a viral in origin. So वो आपको समझना है को बैक्टीरियल ओरिजिन नहीं है वायरल ओरिजिन है वायरल के लिए एंटीवायरल लगेगा बैक्टीरिया के लिए एंटीबायोटिक लगेगा so the only thing is what I'm trying to emphasize is that if you see the common things in your OPD like flu kind of illness, don't forget about antivirals. They are there in the market. Please use it because that is most rational to use it in these patients. And there is a very specific drug called Oseltamivir which only acts against the flu virus. So that is most important. So I urge you all to have a good thought on this antiviral and make your practice more safer, more academic practice, and more rational practice by using antiviral also along with your antibiotics.
So thank you so much. Thanks so much, sir. Because you're sharing your experience. I'm sure the audience who has attended this will benefit out of it, and it will give them more confidence. Thank you so much, sir. Thanks all the doctor who took time from the scheduled and attended this. And once again, sir, apologies, my computer suddenly went off.
No, no, no,
Thanks
I
so
know, I
much.
know. It's a non-human error. Don't worry.
Doctor, there's a
Thanks.
question from one of our participant. The question
Yeah.
is, are there any typical sign and symptoms of flu in pediatric and adult to start oseltamivir, or we can start it to any flu patient?
Yeah. So again, I'll again answer that question in a very simple way. That you don't have to look for too many signs and symptoms. It's a more of a simple. I've told you in that side also. The 4 or 5 symptoms are common with all influenza-like illness or all flu viruses. So that is very common. So the moment you see cough, cold, fever, headache, body ache, this is almost flu. Almost a clinching a diagnosis of a flu. So better we start this patient whether it is a pediatric or adult with antivirals in this patient. So I think to answer questions of my colleague. Very simple. Don't go for hi-fi test. Use your clinical acumen and use antiviral upfrontly.
All right.
Thanks,
Thank you so
doctor.
much, doctor.
Thank you. Thank you. Thanks, doctor. Can we sign off? Sir, we can sign off. Thank you so much. Wish you a very pleasant afternoon.
Thank you. Thank you, sir.
Thanks, Payal. Thanks, Payal.
Yes. Bye.
Thank you. Thanks, Anjana.